Hello, I'm Dr. Doug Merrill. I'm the Chief Medical Officer and Senior Associate Dean for Quality and Safety at UC Irvine Health. I want to bring you a short message to help everyone understand the planning and readiness at UC Irvine Health for any possible patient who comes to our clinics or hospital with the signs or symptoms of the Ebola virus, or who actually has this disease. It is very unlikely that this will happen, but just as with fire drills, we want to make sure that a rare event is planned for and that our people are safe because they know exactly what to do. Here's what's most important for you to know. UC Irvine Health has the equipment and processes in place to care for these patients and to keep our healthcare workers and other patients and their families safe. Also, we have a plan and are committed to training our healthcare workers to ensure this safety. If you have questions after watching this video, please talk to your supervisor or visit the Epidemiology and Infection Prevention SharePoint site on the UC Irvine Health intranet. A shortcut can be found by clicking the large red banner on the intranet homepage. If you suspect Ebola in one of your patients, please call Infection Prevention immediately at 714-456-5221. That team is available around the clock, 24 hours a day, 7 days a week. Ebola virus is a very rare virus which is severe in nature in terms of its potential fatality. It is currently active in some countries in West Africa. Signs and symptoms of Ebola virus are fever, headache, nausea, fatigue, muscle and joint pain, diarrhea, and eventually severe illness and potential bleeding. Ebola is spread differently than other infections in that it is more difficult than measles or chickenpox to catch because it does not go through the air or the water or the food system. To catch Ebola, you have to be exposed to a patient who is sick and whose secretions come in contact with mucous membranes of your nose or your mouth or an open cut on your skin. You have probably heard of press accounts of healthcare workers who have caught Ebola while taking care of patients. We know that if healthcare workers wear the personal protective equipment and use it properly, they will not catch Ebola when taking care of patients with Ebola. How is Ebola treated? At this time, there are no FDA-approved medications that can cure Ebola. Instead, we have to provide aggressive treatment for the patient, careful attention to the patient's symptoms by doctors and nurses, support with intravenous fluids and nutrition, and very careful monitoring of their vital signs and laboratory tests. Ebola is a very serious disease. Up to 70% of people who have contracted Ebola have died. UC Irvine Health has been preparing for several months to care for patients with Ebola. We are ready to screen, diagnose, and treat suspected or confirmed cases of Ebola while ensuring the safety of all of our patients and our staff. We have proper protective equipment and processes already in place. Our frontline staff in the emergency department and in our clinics are already screening patients with regard to their travel history. Personal protective equipment kits that include masks, gowns, eye protection, and gloves have already been distributed to the emergency departments and to the primary care settings. These must be worn when caring for potential Ebola patients. What do you need to do to prepare? Number one, there will soon be computer-based training for all of our employees to review the processes involved with screening and managing Ebola patients. Second, if you're going to be in a care area that will likely be taking care of these patients, our infection control specialists will be working with you and your managers to prepare you. You will see on the screen a card. This information will be distributed to all waiting rooms and front desks of all clinics and the emergency department. This card of information will prompt patients to report any travel to West Africa in the past 21 days or to the Arabian Peninsula in the past 14 days. It also lists specific countries in West Africa where Ebola is now present. It lists other countries where other important viruses other than Ebola may be found now. Another screening tool will be distributed to all receptionists in these same areas, giving further instructions on what to do and who to call if one of their patients reports personal travel to one of these areas. I want to thank you for the very high quality of care that you provide all of our patients here every day at UC Irvine Health. It is unlikely that you will ever encounter a patient with Ebola. It is unlikely that you will ever encounter a fire here at the hospital or in the clinic. In both situations, we want to make sure that you are completely prepared and safe in taking care of such a rare event. I am confident that if ever we do receive a patient with Ebola, that patient will receive the best possible care and our staff will be supported and safe. Thank you.